Fluid therapy is also a common occurrence in the veterinary hospital. Intravenous fluids support the circulatory system, aid in counteracting dehydration, and provide appropriate electrolytes and other needed substances to the patient. Occasionally, additional solutions and medications may be added to the fluid bag. In these situations, the bag should be accurately identified with the added products. The label should include the name of the drug, the amount added, and the date it was added. These intravenous components must remain sterile, so the utmost care must be taken not to contaminate the fluids, the catheter, or the fluid delivery system. Setting up IV fluids for a patient is not difficult. Remove the protective tab from the fluid bag to be used. After unwrapping and extending the fluid administration set, insert the tip of the administration set firmly into the opening in the bag. Once this internal seal has been broken, the fluid will flow into the drip chamber. This should be aided by squeezing the air out of the chamber until the chamber is half filled with the IV solution. With the flow valve in an open position, allow the fluid to completely fill the tubing prior to hooking it to the patient. Proper insertion of an IV catheter will be overviewed in the following section. The rate and amount of fluid the patient needs is determined by the veterinarian based on the illness, the condition of the patient, hydration levels, and several other parameters. The rate at which fluids are given to a patient must be very closely monitored. Fluids are most effectively delivered with the aid of a fluid pump. Such pumps accurately regulate exactly how much fluids the patient will receive. You will want to familiarize yourself with the type of pump you have in your facility and the proper operation of it. Most fluid pumps allow you to control the rate and the total volume of fluid delivered. These pumps are also equipped with alarms that notify you if fluids stop flowing for any reason. This is a common occurrence with hospitalized animals on IV fluids, as many pets will circle or get into a position that impedes the flow of fluids to the animal. The alarm also notifies the caregiver when the fluid bag is empty. Where fluid pumps are not available, gravity serves to push fluids into the ill patient. A bag of fluid hanging 2 to 4 feet above the pet will sufficiently propel the fluids. There is a flow rate valve that will determine how fast the fluids flow. Once this rate has been determined and set, it must be carefully monitored and maintained, as the animal's position will greatly affect the flow rate. This becomes especially dangerous if too much fluid is given to the patient. Too much fluid can easily result in death, so be very careful in controlling the fluid rate. You should also be aware of the type of administration set being used. Most macro drip administration sets produce a large fluid drop, while the micro drip sets produce a small drop. 15 macro drips equal 1 milliliter of fluid, while it takes 60 micro drips to equal 1 milliliter. Regardless of the fluid administration equipment you're using, you should always be very cautious in administrating only the amount of fluid prescribed at the rate set by the veterinarian. Caring for an IV catheter poses yet another nursing concern. It is important to maintain the catheter's function and sterility during its time in the vein of an animal, without contaminating its sterility. It should be bandaged in such a way as to protect it from the dog or cat's attempts to lick or chew at it. Notice how a loop of tubing is formed so as to minimize the direct pulling out of the catheter. Animals that show any tendency toward chewing at their catheter should have an Elizabethan collar applied. This will dramatically reduce their chances at removing their own catheter. Wrapping or bandaging the leg and catheter also reduces their chances of dislodging the catheter. Another important step when maintaining a catheter is the use of a heparin flush immediately upon discontinuing the flow of fluids. This diluted heparin solution helps prevent blood from clotting in the tip of the catheter, preserving it for future injections or IV fluid administration. Another flush may be needed to reinitiate an adequate flow of fluid through the catheter. A catheter should be checked regularly to assure that it is still in the vein. Swelling or tenderness may be an indication that the catheter needs to be changed. A catheter should not be left in place more than 3 days, as it is likely to become infected or cause excessive inflammation. Proper administration of fluids and care of catheters are very important issues in caring for the hospitalized patient. Your attention to the steps discussed will make a significant difference.